Hello, everybody. My name is Jim Howard. I had the privilege of working as a support coordinator in Northwest Florida in the Panhandle for the last 15 years. One of the things that we wanted to do was a workshop for our direct care providers to help them understand better documentation. The real need, of course, has been statewide. As our consumers get older, we're noticing the state's been doing medical necessity reviews, or we've been asking for additional funds due to their health and safety. And a lot of times the state reviewers go in and they review the notes from our direct care providers, personal supports, for example, and they're denying the service, or they're reducing services, or they're putting different things in because it's a least cost effective type thing. So we wanted to do something today on helping providers write a better case note and get better results from it. So I'm trying to start up here and make sure everybody can see this. Here we go. So that's why we came up with writing good case notes. A lot of changes have been happening over the last several years, and of course with iConnect and EVV technology, we have to find a way of being able to read, write, and save and receive notes electronically. The old adage of writing it on paper, doing checklists, things along those lines have gone to the past. So we've got to find a way of creating kind of a template to use out in the field. With the new EVV applications, you can actually do speak into an application and have it write for you. So we need to look at perhaps creating a template that providers can use in the field to help jog their memory as to some of the things that they really need to write and discuss. So that's what we're going to talk about in this one, hopefully using key points in this workshop to create a template that works best for your situation. Because each person is unique. Each agency offers or provides different services. So you've got to look at what works for your people, what works for your staff, and creating some sort of template or cheat sheet so that if they're in the field, they're ready to do a document, a note of the things that they've just done. Kind of a trigger to, hey, I need to talk about different things like that. So the idea behind this was to be able to create a template or a trigger to say, hey, I need to discuss this. So one of the first things we want to talk about is some of the key elements of a case note. We've got to be able to list support plans on each note. We have to list how we're offering our consumers choices and how are we assisting them in daily activities. So key elements of a case note, we have got to be able to list how we're assisting them in meeting their health and safety needs. If you learn anything else from this workshop, you've got to find ways to address those health and safety needs. List what your concerns are about leaving them alone. What would happen to your consumer if they didn't have your service or you weren't there to help them with things? State the reason why he and she requires your service to protect that health and safety type needs. So when we did the last workshop, a lot of the feedback came back with, can you please provide examples? I do want to point out that a lot of times our personal supports or direct care people are doing a lot out there in the field, but they're not giving themselves credit for it. And we've got to refocus our efforts on what can we do to make sure it's documented, to show the different things that we're using. So basically, I wrote down 3 kind of generic support plan goals here, and we're going to be listing examples of each. So the first one, of course, consumer needs assistance with their daily living skills. Another support plan would be consumer needs assistance with food planning, meal preparation, and shopping for healthy foods. Or the consumer needs assistance in understanding their finances, their bills, budgeting to continue living independently in the community. So if we take the first one, they need assistance with daily living skills. Staff reminded Sally of the need to dress for warmer weather and offered choices for appropriate clothing. Or staff assisted Sally with showering to ensure she was ready to attend the program. They offered her a choice of shower times that would better meet her needs and interest. Staff assisted Sam in and out of the tub to ensure his safety because he's a fall risk. Um, he would be a fall risk if he didn't have that type of assistance. He didn't have someone there to make sure he's stepping on the mat, that he's able to dry off appropriately, and to protect his safety. Another support plan example would be consumer needs assistance with shopping or for healthy foods. So staff offered suggestions in budgeting and comparative shopping. Staff assisted Sally to understand how much her total food bill would affect the funds in her checking account. Just a brief sentence about, hey, we went shopping and got food. That doesn't tell a reviewer anything. So if you're in the store and you're constantly looking at prices, you're looking at maybe some generic brands, you're trying to educate your consumer about what might be better, what might be more cost effective, what might be healthier. So we talked with Sally about healthy food choices. We talked with Sally about eating more greens and vegetables, perhaps a salad versus a bag of Cheetos. Third one, consumer needs assistance in understanding their finances, their bills, and their budgeting. So staff assisted Sam in reviewing his monthly bills and writing down the dollar amounts of what he's, what they are. Staff reviewed the overall budget, educating Sam on ways to save money. Maybe Sam wants to take a trip, in a few months, and he needs to save some money to go on the trip. So we're looking at his overall goals and the things that we're doing to educate and expose him to different things and offering him choices. Consumer needs assistance in budgeting and saving. Staff educated Sam on upcoming events and trips that he has shown an interest in. Staff encouraged Sam to keep on saving and planning for his future wants and needs of his choice. We had in another workshop that we did, we had a companion provider ask about more examples. The consumer really loved fishing. That was his heart and soul of everything. So staff wanted to know, well, how can I document that? Well, if the consumer really likes fishing, there's lots of different interests, especially in Florida. We have saltwater fishing, we have freshwater fishing. So we're educating Sam to the different kind of fish that you can catch in saltwater, different kind of fish you can catch on freshwater, the difference between fishing from a boat, the difference between fishing from land, the difference in cost of a rod and reel versus a cane pole, the different kind of lures that are out there, the different kind of baits that are used for each one. And of course, there's always YouTube for education. There's lots of fishing videos out there. So it's a matter of, finding exactly what Sam would like to do, offering him choices, exposing him to the different type of environments, taking Sam fishing, saltwater fishing off a bridge, taking him fishing off a bank, a lot of the different things, everything along those lines count. We've got to be able to write it down to showing, hey, this is what we're doing to help Sam and educate him in different ways. Another big one is addressing the consumer's health. How is staff helping with the consumer's health? Are we prompting Sam to take his medication? Are we making doctor's appointments? Are we communicating with the doctors about concerns and side effects that might be happening with the medicines? How is staff educating Sam about possible side effects of his meds? If you're unsure about the medicine that Sam might be prescribed, a really good website out there would be WebMD as far as looking at side effects or possible concerns, how it interacts with others. A lot of times talking with a pharmacist, going, hey, what sort of side effects is happening here? Does this medication interact well with the other medications that he has? Sometimes a pharmacist is a wealth of information. Addressing personal safety. How much assistance is staff providing to help protect a person's health and safety? What are the key concerns about the consumer's safety, such as are they a fall risk? Um, do they walk up to total strangers in a grocery store and start having a conversation? Um, if they're left alone in the bathroom, will they start a fire? Um, different things along those things. What are we doing to help protect the person's safety? Safety in the home, safety in the community. How is our service helping to protect personal safety? Safety and issues and concerns. It's important to document what staff is doing to help protect safety in every case note. And it's important to address what would happen if the consumer was left alone without assistance. The Medicaid reviewers have got to pick up a note and read through it and understand how critical your supports are in helping to protect a client's health and safety. If you can find ways to document that, list examples of that, list concerns about that. What would happen if your service wasn't there, or what would happen if your service uh, goes from 8 hours to 2 hours? What are the key issues about safety, and what are your concerns about it? Find ways to document it so that any reviewer who reviews that case note can understand why your service is so critical to help them. Talk about behavior issues. Case notes help justify extra help or assistance. What is staff doing to help assist with behavior issues? Is monitoring needing at special times of the day? Is staff finding ways to, help calm someone down? Do they need to take a short walk? Do they need to breathe? Do they need to count 10? What does staff communicate with others about ideas that work to resolve problems? An example of this, at one time I had an elderly gentleman who had a huge fascination with water. He would go in the bathroom and run, the bathroom had 3 sinks in it, he would run water from all 3 sinks and would stand there and watch it. He would play in it. And 30 minutes later, the entire bathroom is flooded, including the consumer. So they found out that, they kind of had to watch whenever he went to the bathroom and, give him a few minutes and then kind of prompt him going, okay, you've washed your hands. Now it's time to dry them off and it's time to come out and do other type of things. So finding ways to document about behavior issues or about behavior concerns, and the things that we're doing to help protect their health and safety. Remember, if it's not written down, it didn't happen. A lot of times our staff out there in the field are doing a lot to help protect a person's health and safety. But it's not written down. So you've got to give yourself credit for all the extra things you do for your consumer. Your documentation and details about a consumer's health, safety, and concerns will help preserve and maintain Medicaid funding for future supports. In summary, every case note should include, how is staff addressing the consumer support plan goals? How is staff offering choices and educating consumers about those goals or their interests? How is staff addressing concerns about health and safety or behaviors? And how are you communicating with others? That means such as, how are you communicating with doctors? Maybe you're seeing some strange side effects because they just started a new medication. How are we communicating with other staff about the things that we're seeing or concerns we might have? How are we communicating with support coordinators about the different types of needs that the client has, or other concerns? So documenting your communication styles, how we're communicating with other staff about concerns or issues, should always be included. With that, and that's the end of the basics. You can find us at the Provider Network on our website at bymysidetoday.com. You can email us directly at by my side, the number 2day.com at gmail.com. So that was by my side, the number 2day at gmail.com. We want to thank you so much for the things that you do. We will be sending out a survey to see what other type of trainings that you all might need to help you out in the field to help, you know, provide staff retention, staff education, and also to, help do what we continue to do. So we want to, once again, we want to thank you for what you do, and thanks for your time. And please contact us and let us know what we can do to help you in the future. Thank you so much.